Good morning and welcome to the Digital Skill Talks. Today we have the episode number 10 that is called From Innovation to Inclusion Advancing Digital Health Literacy. In fact, the Digital Skills Talks is a format of monthly online events launched by the Digital Skills and Job platforms. These episodes have been taking place since January 2024, touching different topics. For example, artificial intelligence, virtual works, cybersecurity, and data, but always with this having a focus on skills. Every month, the Digital Skills and Job platforms invites technology expert for a maximum of 30 minutes interview. Today, we have three speakers. Let me introduce you our outstanding speakers and experts. We have Katja Nacevski, Program Manager from Skills Partnership Health Industry at EIT Digital. EIT Health, sorry. We have Diane Whitehouse, the Principal eHealth Policy Consultant and Editor-in-Chief at EHTEL. And we have also Juliette Verwer, advisor at the Dutch Patient Federation. And let me start the interview with Juliette. So we know that digital health literacy is a critical skill in today's healthcare landscape. But really, digital tools such as electronic health records, telemedicine, wearable health devices, and AI-driven diagnosis are becoming integral in medical care. But for patients, these advancements can be an opportunity, but also a challenge. So, from the patient perspective, what do you think are the biggest barriers to digital health literacy and how this can be addressed?
Well, thank you. There can be many barriers for patients. For instance, they need a device and they need connection to the internet to be able to receive digital healthcare. And in the Netherlands, I see professionals use at least one, but more often more tools for digital healthcare. And most of these tools help the professional as we see double aging coming up. And we expect the need for healthcare to exceed the availability of it. But by taking the healthcare professional as a key user, developers pay less attention to what patients need in digital healthcare. So they see the professional mainly as their key user instead of the patient. And then I also see every GP, every hospital, every therapist has their own portal to show patients their information. But when you use, by instance, a telemonitoring app that comes on top of the portal, and then if you want to use asynchronous communication with your therapist, that comes on top of the app for the telemonitoring and the portal. So it takes a lot of skill for people who are at that moment not in the happiest place of their life to know and to weigh what do I use as a solution. So how could they be addressed? Well, first of all, I think it would be necessary to for developers and suppliers to choose patients as a key user of their digital tools. Secondly, I think organizing interoperability of all kind of digital tools would be very helpful. And thirdly, I think by trying to make the field less complicated. For instance, it could be by using one entry for patients, which takes them to everything they need.
So thank you. I see that simplicity and interoperability are still the key also for patients. So, and being an interoperability expert, I'm super grateful to to hear that because my PhD was in interoperability. So next, let's go to Diane. Diane, you have long and proven expertise in policy development and stakeholder engagement in digital health and digital innovation from where you were working at the European Commission and then in different positions and now in EHTEL. How can multi-stakeholder engagement, including patient, healthcare providers, and even technology developers, help to shape more inclusive digital health policies? What is your opinion on this, Diane?
Thank you, Jose, both for the nice compliment and acknowledgement and also for the invitation to this 10th talk, which I think in a way comes full circle back to your first, which focused there very much on citizens' involvement and citizens' councils. I'd like to talk about inclusion in a very broad sense, and not just as it was historically about perhaps people with disabilities and accessibility, which, as Juliette has emphasized, is so important, but in a more general way about making everyone's voices heard, and really listening to everyone's needs, and not just listening, designing for and introducing people's needs. Purely as background, we know that this has had a very long development in the European Union and more globally, and the focus on multi-stakeholder involvement has been a developing and an enriching one, involving many different types of stakeholders. And now we're at a stage where we refer more broadly to health ecosystems or ecosystems, depending upon which pronunciation you use. Many groups are involved in the digital health field, whether it's, as in our association, many of them are actually healthcare providers and healthcare authorities, public sector, also private sector, and whether their responsibilities are ultimately regional, national, or international. Without reflecting too much on the entire scope, from the involvement and engagement of stakeholders like large international organizations, the World Health Organization, the OECD, the European Union itself, and the wide and increasing richness of partnerships and platforms that are coming on board, and about which we'll hear more, I'm sure, during this conversation. I think what's terribly important is also to build capacity. And that's not just in terms of scaling up, but it's actually in terms of people's competences, people's skills, and people's abilities. I'd like to use the European Health Telematics Association, which is where I am today, as an example. And of course, we've been through 25 years of development since these notions of inclusion, engagement, and the onboarding of stakeholders really began to take hold in Europe. And that was really our foundation around the turn of this century. So we describe ourselves as a European eHealth multidisciplinary stakeholder platform, involving some 50 group members that range across healthcare providers, authorities, industry, small and large, research institutions, and patient concerns, patient associations. And that wealth, that breadth is represented not only in our board, our 13-member board, but throughout all our members. for your SME audience, some of them are indeed smaller companies. Couple of examples include Kellion in engineering in Italy, and also Sourcex that bridges a link between both Australia and North Macedonia. Their interests are technical a lot, yes, ranging from AI to telemedicine and much, much more. But the reality is it's not just about the technology, and that's an important message to recall and take home. I think a major item that I'll focus on is the opportunity for consultation and engagement that comes at the moment through the upcoming European health data space that we'll all hear much, much more about in around a fortnight, 3 weeks' time. And my last message ultimately would be engagement, stakeholder engagement is about getting involved in large-scale projects, large-scale pilots, and large-scale partnerships. Thank you.
Thank you, Diane. And as always, very elegant the way you connect digital inclusion with disability capabilities and skills. And also, I like that you have mentioned the European Health Data Space, because we at Digital Europe are coordinating the European data space on skills and employment. So if we mix the European data space for skills and the European health data space, we will be exactly in the confluence of these data spaces and the topic that we are covering today.
My colleagues, Jose, I'm so glad to hear that link draws us together even more. I think my colleagues in EHTEL would say to me and to us all that it's not just about the space, it's about implementing it. So, let's put the focus on doing it and doing it as quickly as possible. Yeah. Thank you.
Yeah, let's do it together and as soon as possible, for sure. And let me move to our friend Katja, that is the program manager of Skills Partnership Health Industry at EHTEL. And Katja, as coordinator of the large-scale partnership for the European health industry within the Pact for Skills, how do you see the role of digital skills partnerships in improving digital health literacy across the healthcare sector?
Yeah, thank you, Jose. And I would like to also say thank you, of course, for having us, and to Diane, also from my side, compliment for kind of bridging into this next question or into the next topic of discussion on the large-scale partnerships that you mentioned at the end of your response. So overall, I would say that the various skills partnerships bring significant value, of course, to the health sector, but also to other industries, which are being impacted by the skills gap that we are experiencing in Europe, and that has been, of course, augmented by the twin transitions to the green and digital transition. It's good to see that this is also being recognized by the European Commission through reports such as the Future of European Competitiveness and initiatives like the European Year of Skills, which already concluded, but we're seeing that it will be continued, and that's positive news for us, of course, as coordinator of a large-scale partnership. In the very soon to be announced, actually next week, to be announced, the Union of Skills. So I think from our side, we are looking towards what the Commission will announce with regards to the Union of Skills. And of course, it's also interesting to see that with the new Commission, which came into office last year, We now have an executive vice president, Roxana Menzatu, whose title includes skills, people, and preparedness. So I think all points that have been mentioned today. So when it comes to the health industry more specifically, at EHTEL, we've had the pleasure, and of course with the support and encouragement from the Commission under the Pact of Skills, to bring together various actors from the health industry together and start discussing these topics around reskilling and upskilling, which of course directly or indirectly will have an influence on digital health literacy. The impact of the COVID-19 pandemic is, of course, still being felt. This, along with the aging population, which has been mentioned today, and also the large increase expected of chronic patients by 2050, we believe that the health industry will play a crucial role to ensure that medicines and medical devices are there for a functioning healthcare system. At the same time, I don't think we can decouple the production and the availability of these products from people's ability to be able to use them, like Juliette was mentioning before, but also by both, not just patients, but also by healthcare professionals. So this is why we are working at the Skills Partnership for the Health Industry. We're working closely with other skills partnerships in the health ecosystem to make sure that we are driving these changes and implementing these changes together. When it comes to our multi-stakeholder, if I can use that word again, partnership more specifically, we currently have quite a variety of actors, such as higher education institutions and providers of vocational training, representatives of industry directly, either in the form of individual companies, industry associations, regional associations, as well as SMEs and startups. And while our skills partnership was only established in December 23, we have already seen quite some interesting interactions between our members, as well as having the partnership as a platform for our members to be able to present good practices, but also common interests, common issues. So we think that here the skills partnership, and I mean, I very much agree with what Diane was saying, that it's important to have these conversations and these collaborations moving forward.
Yeah. And Katja, talking about the large-scale partnership for the European health industry, really EHTEL has just launched Bright Skill, that is a blueprint project that you are coordinating, which targets specifically the upskilling and reskilling of the health industry workforce. What are the objectives and the next steps in this project, and what is the impact really?
Yeah, no, indeed, we're really happy to have just kicked off the Erasmus Plus funded Blueprint project in January of this year. So we have a consortium of 19 partners and 5 associated partners from 11 countries. These partners, much like the large-scale partnership, are a variety of stakeholders, as quite common for a blueprint type project. So we have higher education institutions, vocational providers, labor market actors, health industry organizations, SMEs, and also some intermediary network organizations such as Digital Europe. I would say the objectives of the project overlap quite significantly with the overall objectives of the skills partnership, which were set out at the start of the partnership in December of 2023, like I mentioned. Since we see this project as really one of the first steps towards fulfilling the objectives of the partnership and also contributing to the Pact for Skills in general. So just quickly, the objectives and at the same time the next steps, as we're at the beginning of the project, are building a critical mass for up and reskilling efforts in the health industry, analyzing the urgent and emerging skills needs in the workforce through these multi-stakeholder cross-border approaches that I've already mentioned, but also developing and delivering an actionable strategy for the EU health industry. So to set a clear roadmap for expansive implementation, both on regional and national levels, but also for the whole European ecosystem. We'll, of course, be designing and piloting some training programs through hopefully innovative pedagogical methods. And this, of course, these trainings can't go without certification and accreditation frameworks to be put in place, so that we're making sure that across Europe we maintain this mobility and industry standards. At the same time, we're looking at we're looking for further interested organizations to join the skills partnership, as this will, of course, allow the project to have a wider or the widest possible reach within the health industry, but also in the health ecosystem in general.
Yeah, thank you, Katja. Being the coordinator of two blueprint projects, one in software services and cloud, and another in artificial intelligence, I will also add to your comments that one of the most important things is to agree with the key players in Europe what are the key job profiles that are needed for the European market, to support universities and VIT providers on developing training courses and materials for this, and also micro-credentials for this kind of professionals to up skills and re-skills then into a better job market, let's say. And
yeah,
then
definitely. I mean, like I mentioned, we see this analysis of urgent and emerging skills needs as one of the crucial points, and this is why it will be one of the first actionable topics that we come to even in this first year of the project.
Exactly. Thank you. And still in the area of the skills partnership, I will go back to Diane. And considering that EHTEL is also a partner in another blueprint project called Be Well, which is mapping the digital and green future skills sets needed by the healthcare workforce to develop a green and digital skill strategy. Really, what do you think are the skills that you identify, and what are the next steps?
Thank you, Jose, and thank you, Katja. And I think there's quite a link between what Be Well does, both as a project and as an alliance, and indeed as a partnership with Bright Skills. And I know that colleagues were invited very kindly to your recent launch, so I can see that there's every expectation of close collaboration there building up. Be Well's an Erasmus Plus project. So it's very much at the present moment about workforce development, upskilling and reskilling. So enormous synergies with everything that's been talked about so far. So we have 40 or so members and growing. The partnership itself has 50. And forgive me if I focus today on digital skills, which is the content of this discussion, rather than the green skills side, which is also equally part of what Be Well does. In terms of the needs identified and the skills needs identified, as you've asked me, Jose, I think much of what Be Well focuses on had its origins in the crisis of the COVID-19 pandemic and the reaction to it, as well as understanding the various crises, what people call polycrises, affecting the healthcare workforce. And colleagues here, Katja and Juliette, have very nicely covered some of those crises today. It's increasingly evident that it's about focusing on other emergencies and other pressing topics, and these also include security, cybersecurity, safety in general, whether that's in hospitals or in residences or in homes. And the project has spent quite an amount of time exploring what the identified needs are. And I think I'll just draw attention to four. One, because the focus is on workforce, are on the several types of personnel who are lacking in skills, whether that's clinicians, whether that's nurses, whether that's administrative officers or managers, or, as I heard an excellent speaker say recently, on an additional part of the workforce, the health and care workforce, which are also the informal carers and people and patients themselves. And I see nods there. There are several domains where skills are missing. I've mentioned cybersecurity, data analysis, databases. Data is clearly key. Health and care data are key. Data protection and privacy, and indeed, one might say at a very simple level, but the use of platforms and varieties of platforms, because it's very often not just one platform that is being used, but multiple. Skills missing and needed across Europe. And in fact, in Be Well, that ranges north, south, east, west, but particularly with a kind of an Eastern focus as well, I think. And among the emerging skills that the project has also investigated, looked at, is working on with focus group type work. Couple that come to mind in the digital field are an understanding of AI, particularly for clinicians and general practitioners, what some people would call, therefore, family doctors, the basics of medical devices, and what is a medical device and what is not a medical device. And one that interests me a lot is 3D printing of devices and appliances. We tend to hear about it not so much, but I think it's a fascinating area. Among the next steps, therefore, is clearly to work alongside patients. Very, very important there. But over the next 12, 15 months, it's getting people to follow digital skills courses and programs. And Be Well has designed at the moment between about 10 and 15 of those that it's trialing, testing, and getting people to follow in a variety of European languages, from Norwegian on the one side to Romanian, Bulgarian, for example, on the other, helping with a collation or collection of good practices available across Europe. And there are about 50 of those online at the moment. I believe it probably complements quite well what's in the digital skills platform collection of training and courses and programs, making available 2 policy briefs Look out for those from April-ish onwards on both digital and green. And last but not least, working on an open public consultation that will help formulate forthcoming policy in the area. And you'll be seeing a lot of Be Well people up and about at a wide number of events and activities across Europe, and those will be soon on our website. So interesting times ahead, and hopefully meaningful and actionable ones.
Thank you, Diane and Katja. It is clear to me that these two sector skills alliances, Bright Skills and Be Well, have enormous synergies, and you should be very good friends and collaborate a lot for the good of the European workforce in health and healthcare. So let's then move to Juliette again. And as you have seen, we have been talking about skills need for the healthcare workforce and the health industry. According to you, are there specific digital skills for that patients need to acquire, and what role can patient organization play in educating and empowering individuals to engage with digital health tools in a confident way?
Oh, well, thank you. Well, let me start off with saying that no one should be denied healthcare because of limited digital health literacy. And having said that, I think it would be very good if patients and informal caregivers, as Diane said very well, they should try and develop their digital health skills. In the Netherlands, we have got Alliance of Digital Society, which is a public-private collaboration, and they have done some research for the skills that patients need to receive digital healthcare. They have categorized them in four categories. The first is the basic digital skills, using devices and navigating through websites, for instance. Then you need the health literacy, understanding medical information, being able to decide what information is legit, knowing where to ask for support. Thirdly, you need self-management skills to be able to monitor your health yourself based on self-collected data, knowing when and where to go for help. And fourthly, you need privacy and security skills to be able to recognize phishing, knowing how to share data safely, etc. And then what we do as a patient organization to help patients in choosing the right app is we have Digitale Zorggids, which is a digital care guide. Here we help patients choosing their app with the experience of other patients. Then we have applications which are recommended by other patients, and it helps people choose an app to by the experience of other patients, because they might be a patient like me and they use this. So that's one thing we do. Furthermore, we help patients with tools that can help them in shared decision-making about the way they receive healthcare, whether it is physically, digitally, or in a hybrid way. And thirdly, what we can do, but we don't do it as a patient organization, but we use our influence to get it organized by the government, is to organize technical support for patients, because we know that people who start with support using a portal, for instance, they are more likely to try something new as well. By supporting them using their digital skills, we can empower them and motivate them to try new digital solutions and experience the full benefits of digital and hybrid healthcare. And in the Netherlands, this is done by Helpdesk Digitale Zorg.
So many thanks for your explanation, and I think we are going to move to the last part of this interview that is called Flash Questions. I'm going to make you one question, and each of you will have like 2 minutes to answer. It's a very simple question. It's just more as an example. If you would like to share one good practice or best practice in the digital health literacy that you are aware in your area of expertise. And let's start with Katja, then Juliette, and then Diane. So, Katja?
Yeah, thank you. I'll try to use my 2 minutes wisely. So I'd like to highlight the Deep Tech Talent Initiative, which is a program led by the European Institute of Technology and Innovation, so by the EIT, that will skill 1 million people, or has pledged to skill 1 million people within deep tech fields between 23 and 25. So currently, I mean, we know that the Europe lacks talent and skilled force necessary to leverage the upcoming technologies in green digital transition. And this initiative is targeting 3 main groups. So pupils, especially young women, students in higher education, but also adult learners who are already in companies and on the job market. So until now, there have been over 1 million pledged talents through the website, almost 1 million trained talents, and 395 organizations that have signed the pledge and have made 184 courses available on the webpage.
Thank you, and let's move to Juliette.
Thank you. The scalable solution or scalable how do I say? Is the Day of Digital Inclusion by which also Alliance of Digital Society hosts. In this day, we have got all kinds of organizations come together and experience what patients might experience or citizens might experience. For instance, they've got gloves which make your hand shake, and then they ask you, can you please log into your EHR, or can you please do this, or can you please put in your measurements? So you can actually see what it does if you have a certain problem, and you can feel the need to make it more inclusive. And you can also try and find what way can I help these people most. So that's hosted by them, but I think it would be very fun and good to have that in other countries as well, because I can think many patients also European-wide can benefit from that.
Okay, thank you, Juliette. And let's give the turn to Diane. We are looking forward to knowing more about your best practice.
Thank you. Of course, it's a challenging question because there are many, and I'll limit myself to one. I'm a great admirer of what's happening currently in Scotland around skills. Scotland is one of the UK's 4 home countries, and the choice I would make is the National Health Service Education for Scotland, or NHS Education for Scotland, which is all about building digital skills leadership in that country. why do I choose it? Because it covers a range of types of leadership, both from top leaders in the services and in the health and the care area, but it's also brought together people from the housing sector, the emergency services sector, and also the voluntary sector, third sector. It not only focuses on training for individuals, but it also encourages teams to join. So groups of people to sign up as a workforce team together so that they can learn together collaboratively. And another richness about what they do is they have loads and loads of resources that are open to all of us. So I would encourage people to visit their website and go there. And much of that is video based and is short, is sweet, is kind of like micro learning, quick learning, and learning in chunks. So super work that they're doing, and I know that they're very open to sharing those experiences with other players, other partners, other people. So chapeau to them. Well done.
Thank you, Diane. Let me summarize the three takeaways or key takeaways that I consider from this data skill talks of today. For example, the first one is connected with the European values. We cannot leave anyone apart from the digital health literacy. Everyone should be included, and everyone has a space for this. Then another is related to collaboration among different stakeholders, and also collaboration among existing projects, because we have seen that we have enormous synergies, for example, with Brighter Skills and Be Well. And then the last is the importance of identifying best practices, contrasted best practices that works, European best practices, and then scale up in different regions. With these three key takeaways that I wanted to summarize, I would also say thank you again to Diane, Katja, and Juliette for your bright comments and for being part of this interview. I just want to say that we will be spreading the message through our social networks and also in the digital skills and job platforms, and that I invite you to the next interview end of March. So thank you, and you will know more about us in the social networks. Thank you. Bye.
Thank you so much. Thank you. Goodbye all.
Bye.
Bye.